From the Open Voice Network, Voice Chats, we host conversations on tech, retail, commerce, and inclusion around voice.
Hello, I'm Alissa Paik on behalf of the Open Voice Network. On this episode of Voice Chats, we're lucky to have two members of the Open Voice Network and the healthcare community. Harry Pappas is a technology entrepreneur with a focus on health and wellness technology sector. Harry is a speaker at health and wellness conferences and trade shows around the world, and he and his team are the producers of the award-winning Intelligent Health Pavilion, a technology-centric digital hospital. He's also the creator of the iHome and founder and CEO of the Intelligent Health Association, a global technology-centric organization dedicated to helping members of the healthcare community adopt new technologies while driving down the cost of healthcare. Jon Stine is executive director for the Open Voice Network. He has more than 30 years senior level experience and global leadership roles in sales and marketing for the Intel Corporation and Cisco Systems. We want to thank you, Jon, as our champion for the mission and vision of the Open Voice Network. So to start off today, Jon, I think we'd like to just hand it over to you to share with our viewers about the Open Voice Network and kind of the why of the organization.
It gets down to the central word, Alissa, of trust. And we say that the Open Voice Network is about making voice worthy of user trust. You know, the origin story gets back to a coffee shop in Boston and conversations about what technologies would really shape the relationship between providers and patients. But then the conversation moved, within a year to sitting in an executive suite and with senior executives, with a group of us asking, this voice thing, it's coming our way. It's going to be very important. It's going to be a primary interface for all of our consumers, our users, our employees. But how do we protect our brand voice and make it ours? How do we protect the data of our patients and our clients? How do we protect our operational, our commercial data? How is this possible? How do we do this, knowing that this is going to be a critical technology for all of us? How can we make this worthy of our trust and the trust of our patients, our clinicians? How can we make that happen? That's the why, that's the remit, that's the charter, that's the mission and goal of the Open Voice Network.
Love it, great.
Well, I got to tell you, that's really well said, Jon. And that's really the primary reason I wanted to work with you and the Open Voice Network. The points that you just made are so consequential to all of us, both consumers as well as those in the enterprise. So I think this is really a great effort on your part and the members of the Open Voice Network, who are, I understand, from many, many countries around the world. And it's important that we do focus on trust and privacy and interoperability, not just for the consumer, but every business in the world has got to be paying attention to this. So I congratulate you, Jon, and the team, and of course the Linux folks for bringing this to the forefront.
Well, Harry, and thank you, Harry, for being a part of this, because you're bringing your expertise as well as your remarkable world of contacts into raising the proper questions at the intersection of voice and health, wellness, and life sciences. And Harry, we've had conversations, and Alissa, we've been all talking about the richness of voice data. The richness that it's about not only what you say, but how you say it. It's a biometric, but Harry, as you pointed out, and a number of clinicians have been talking to you, this is a biomarker as well, and it could be a leading way for some early diagnosis of very important, medical conditions. So the issue of privacy comes to the forefront, certainly within health and wellness.
Absolutely, Jon. Well, I look at voice, and as you know, Jon, because of my son and his device that he had in his home about 4 years ago, Christmas time, I asked my son, what is that? I said, I hear this music. He says, Dad, watch this. So he demonstrated the Amazon device for me. And John and Alissa, I got to tell you, I saw the future. I saw how this new technology was going to transform our lives. Let's look at how the World Wide Web has changed everything we do. Let's look at the smartphone, okay? Let's look at email. You know, I was at my doctor's office the other day, and there must have been 15 people in the waiting room. They were all texting and emailing and talking. And I said, what has happened here? And voice is a critical component of those platforms. What I see voice as, forget about just health, wellness, and life sciences, but it's going to become the Wikipedia of the world, but through voice. It's going to become a digital global library. Maybe the digital content is from company A or company B, but the consumers are going to have global access to unheard of information and data in a real-time manner, okay? And so when I heard about the work that Jon is doing with Open Voice Network, I said, I'd like to contribute that. I'd like to contribute to that because I want to do social good. And by working with Jon and Alissa, you and the rest of the members of the team, we can deliver social good. And Jon, every day, I talk to people about voice. And one of the things we need to do as a team is to really make people aware of how important voice is, but more importantly, how do we protect that information? So Jon,
Absolutely.
you mentioned biomarkers. How do we provide privacy around that? Okay.
And Harry, critical issues. And also, I think it's important to note, and you know, it's on its way. It's coming toward us. You know, some very recent research from Vixen Labs and Pragmatic Digital pointing out that 50% of American adults who use the internet, which is nearly, you know, it's a huge number of individuals, are using voice technology on a regular weekly basis, and they're searching for things. Now, you know, everyone watching this may say, well, I don't use voice in this way or this way or this way. But voice usage is increasing substantially on an annual basis. And as we look to health, wellness, and life sciences, as well as other industries, we know that people are using voice. Harry, as you said, it's the Wikipedia to search. Yeah. You can speak 3 times faster than you can type. It's a whole lot easier to ask your device to search for something than it is to type it in, and you can do it anywhere you are. Voice is also hands-free. It's hygienic. Think of, you know, filling out your charts, you know, in a clinical setting, faster, more hygienic, and then certainly, you know, voice is just simply inclusive. Even if you are, you know, you're not, let's say, literate or highly literate, you speak a different language, voice can be much more inclusive for all communities, and especially individuals with disabilities.
Absolutely, Jon, really well said. And this is why I'm really pleased that you and I are working on developing the health, wellness, and life sciences community. There are so many uses for voice, both in the clinical setting, in assisted living, nursing home setting, even aging in place and independent living. I see voice as being your son and daughter that are not home because they live in California or they live in London. So this device and voice is your companion.
Absolutely. Absolutely. It's a great point, Harry. It's a constant companion and can be an empathetic companion.
Correct. I can have the voice device. I could get news, and Jon, the example I give is, as you know, I'm a Greek American, born in Greece, but really blessed to be in the United States of America. And I see for individuals, families whose language is a language other than English, how do I use voice to give me today's news? Because I can't read the New York Times.
Right.
I can't read the Wall Street Journal. So I can see whole networks, just like we have news cable channels and we have network broadcast channels. I can see the day where voice technology will offer us channels for everything under the sun. My colleagues and I have been looking at, everything from a gardening channel to a bridal channel, and of course, everything within healthcare. Everything within healthcare. How do we use the voice technology in an operating room setting? And recently, John, as you know, I talked to a lot of the global technology companies, and somebody yesterday said to me, Harry, you'll be pleased to know we're incorporating voice into this new surgical robot. I said, really? Why is that? And they started to outline the reasons why they decided to adopt voice and make it part of this surgical robot and how it will be used by surgeons.